Hi, this is Dr. Eric Westman, and I'm going to talk about the 4 myths of low-carb keto diets as of today. It seems like the myths keep changing. Before I get into the myths, I'd like to give you an update on the latest ADAPT event. The ADAPT event pre or early ticket sales just went on sale for Tempe, Arizona, the Scottsdale, Phoenix area, and that's going to be on October 5th. If you don't know about ADAPT events, it's a way to connect community leaders in low-carb keto and people who are already doing keto and low-carb. In July, we went through 3 towns in the Midwest, and these events are really exciting. It's fun, there are giveaways, there are book signings, and it's my great pleasure to be together with people I've known for years in the Scottsdale, Phoenix, and Tempe area. Dr. Adam Nally will be there, Dorothy Sears will be there, Helen Hiltz will be there, Ben Boccaccio will be there, Philip Wasner will be there. It's going to be a great time. So check out ADAPT Arizona Low Carb Keto Living in the 21st Century. The tickets are on sale now. So the 4 myths of a keto diet, I think the first one still is that a nutritional ketosis kind of lifestyle is dangerous. And I keep hearing that term dangerous, and I just kind of chuckled because it's not like you're near the edge of a cliff. That's danger to me. You know, if you're about to fall over and fall off a cliff, that's danger. A low-carb keto diet now has so much data in peer-reviewed randomized controlled trials in the clinical research world that it would be FDA approved like a drug as being safe and effective if there was a process for that. But there is no process for that. And a lot of the people who are naysayers and bringing it up all the time don't know about this new information. So nutritional ketosis is safe. And in fact, it's effective and therapeutic for lots of the diseases I see in an internal medicine, obesity medicine clinic that I run at Duke. So it's not dangerous, not to worry. The other myth, nutritional ketosis, is ketoacidosis. Well, that's not true, but that probably is one of the basis underlying things that the traditionally trained doctors and health professionals will think about, and that's why they think nutritional ketosis is dangerous, because they think nutritional ketosis is ketoacidosis. But it's not. There is no acidosis. And to complicate things further, there's a medication class on the market now that causes drug-induced ketoacidosis. But again, that's not what this is. This is a lifestyle where you're not eating sugars and starches and you're running your body on fat and ketones. And that's where the idea of a keto diet, the name of it, comes from, so that your body uses ketones instead of glucose in lots of different places. The next myth, your brain needs glucose to function. Just like we were traditionally trained, the brain needs glucose, and well, it does need just a little bit, but most of the brain can run just fine on ketones. And again, that's where the keto diet comes in. Not that it's abnormal or crazy or weird to run your brain on ketones. It's actually a natural thing to do when you're not eating sugars and starches. So you can actually make all the glucose you need internally without eating glucose or starch. Starches get digested to glucose. So the brain does fine if you're not eating sugars and starches. Your body can make all of the glucose it needs, including the glucose that your brain needs. It does need a little bit. Final myth today that I keep hearing is, well, you can't do it long term. Well, and even then, that's kind of the mindset of doctors who say, well, I'm not even going to recommend it because no one can do it long term. Well, that's clearly not the case. And over this last year, we've been in cities around the country. I've calculated probably 1,000 people who come out on a Saturday to the ADAPT events. And I ask everyone, are you doing a keto diet? And all the hands go up. And then I ask how long people have been doing it. And most of these people who come out on Saturdays to hear experts at ADAPT keto events have been doing it for 1.5 years or 2 years. There's something happened about 2 years ago in the U.S. where people just started doing it. There was less pushback from doctors. So absolutely you can do it long term. I'll have people keep their hands up and kind of toggle through how many of you have been doing it 2 years, 3 years, 4 years, and then I'm the only one with a hand up at 20 years in the room, although a few times there's some other people. And if Jackie Eberstein is in the room, she's been doing it longer than I have, so then I don't win the competition of being able to do it long term. But absolutely you can do it long term. I've been using this in my clinic at Duke for about 13 years, and many of my patients have been doing it that long. All the parameters look great. So that's, again, another myth that you can't do it long term. Sure you can. And I help people learn how to do it in an easy way. And more it's easier to do it because the environment of food is changing. Have you seen all of the different products that are available in the grocery stores now that are compatible with a keto lifestyle? That's a clear indication that more and more people are not only doing it, but they're buying products that are truly low in carbs and keto friendly, if you will. So the 4 myths: that it's not dangerous, it's not ketoacidosis, your brain needs glucose, but you can get all of it that you need from what you eat and from ketones. And then it's a myth that you can't do it long term. It reminds me of when the exercise in the 80s, everyone started exercising. Can you imagine a doctor saying, don't even start exercising, you can't do it long term? And a lot of people did buy the exercise machines, and they became clothes hangers, coat hangers. So that just doesn't make sense. Of course you can do it long term. It is safe. And I hope to see you in the ADAPT events that are coming down in October. One just got online for the early ticket sales, save you some money there. October 5th at Arizona State University in Tempe. Hope to see you there.